That's a great question. So I've seen how health technology, especially information technology, has really helped clinicians at the point of care. So for example, having the patient's medical history available, what are their diagnosis, prior test results, and medications. This is very, very beneficial to clinicians as they are treating patients. And I think that it's something that we shouldn't take for granted, because even only 10 years ago or even 5 years ago, a lot of organizations have been on paper-based charts where it was really almost impossible to trace the patient's prior history. And another benefit of health technology includes really involving patients more proactively. So for example, the patients, they have the option of being able to look up their lab results, their test results, and in some instances they're actually even able to see the medical records of what are their doctors writing about them. And it's something, it's a change that I'm seeing, where before the patients would show up to a doctor's office and whatever happened to them, but now more and more patients are getting involved. Thirdly, one of the other benefits I see of health technology, especially on the health information technology side, is that there are the patients themselves have access to more information, not just their own personal information, but as well as educational information, how to take care of themselves, how to be involved. And one of the great things is that, in addition to these information resources, because it's become so readily available to have, whether it's chat technology or video conferencing technology, more and more patients are able to access care easily, to either access their own doctors and nurses, or to be able to access on-call and urgent care clinicians to address their questions. And last but not least, I'd like to mention how, especially with the information technology, analytics really allows both healthcare providers and payers and other healthcare stakeholders to really understand their group of patients better. By drilling down into the data, you're able to identify what are the different subsets of patients you have, and analyze what are the types of interventions and outreaches that might be the most beneficial and impactful for those particular subsets, and then monitor the outcomes of the interventions and use the data for performance improvement and continual iterative improvement.